Hello and welcome to part 4 of skull anatomy. In this final lecture, we'll discuss cranial sutures, junction points, and infant fontanelles. The joints of the cranium are called sutures and are classified as fibrous joints. As we know, in an adult, these sutures are immovable and are therefore classified as synarthroidal type joints. So let's identify the different sutures in the cranium. The coronal suture separates the frontal bone from the two parietals. So here is the coronal suture. Separates the frontal from the parietals. The lambdoidal suture separates the two parietals from the occipital. So here is the lambdoidal suture, again separates parietals from occipital. The squamosal sutures separate the two parietals from their respective temporal bones. And you can see that here. Squamosal separates parietal from temporal on both sides of the skull. The sagittal suture separates the two parietal bones, and you can see that right here. Each end of a suture is identified as a point or area with a specific name, of course. The right and left asterions are points posterior to the ear where the squamosal and lambdoidal sutures meet. So you can see the asterions here. You can also see it here. So it's where the squamosal and lambdoidal meet. The anterior end of the sagittal suture is called the bregma, and the posterior end is called the lambda. So here's bregma. It's where the sagittal meets the coronal. And then the lambda is the posterior end of the sagittal suture. It's where the sagittal meets the lambdoidal suture. Lastly, the right and left pterions are points at the junction of the parietals, the temporals, and the sphenoid. And you can see that best right here. So again, the right and left pterion, the P is silent, that is the junction where the parietals, the temporals, and the sphenoid bone all meet. I remember pterion because it's near our temples. So as you're studying the sutures and the junction points, I would encourage you to develop tricks or mnemonics or something that can help you to identify these parts on a diagram, say, on the exam. And believe me, we will spend time in class practicing with this information as well. Finally, let's discuss the infant sutures and fontanelles. So in contrast to an adult skull, the calvarium of an infant is very large in proportion to the rest of their body, but the facial bones are very small, and you can see that here on the diagram. Ossification, remember that's when cartilage turns to bone, of the individual cranial bones is incomplete at birth, and the sutures are membrane-covered spaces that fill in soon after birth. So you can see that in the infant skull, there's a lot more space here, and that allows for growth. Certain regions where sutures join are slower in their ossification, however, and these are called fontanelles. The cranial sutures themselves generally don't completely ossify until an individual is in their mid to late 20s. And some sutures may not completely ossify or close until the 5th decade of life. Early in life, the bregma and the lambda are not bony or ossified, but instead they're membrane-covered openings called soft spots. And we're familiar with that. We know babies have soft spots. The soft spots are termed anterior and posterior fontanelles in an infant. So I need you to know that the bregma in an adult is called the anterior fontanelle in a baby. The lambda is known as the posterior fontanelle. So here would be bregma, here would be lambda in an adult. Okay. Interestingly, the anterior fontanelle, which becomes the bregma, of course, is the largest fontanelle we have. At birth, it measures about 2.5 centimeters wide and 4 centimeters long. And the anterior fontanelle does not completely close until about 18 months of age. So it is the last soft spot to close. The two smaller fontanelles that close soon after birth are the sphenoid, which becomes the pterion, and you can see that here. Let me find my mouse. So the sphenoid becomes the pterion. That closes sooner after birth, and then the mastoid fontanelle, which becomes the asterion in the adult, and that's back here. One other thing that I wanted to mention before we conclude is what's called a sutural or Wermian bone. And these are small, irregular bones that sometimes develop in the adult skull sutures. These isolated bones are most often found in the lambdoidal suture, but occasionally they are found in the region of the fontanelles, especially that posterior fontanelle. In an adult skull, these are completely ossified and are visible only by the suture lines around their borders. So kind of interesting. Okay, this concludes part 4. This concludes our discussion on skull anatomy. If you have any questions, please let me know. And remember, we're going to practice with this information in class. All right? All right, thank you.